Menstrual health and hygiene is a critical yet often overlooked aspect of public health and education. And maintaining good menstrual hygiene can dramatically improve a woman's quality of life. The consequences of not doing so, however, can prove to be detrimental. But in spite of that, the fact remains that most conversations around menstruation are unfortunately often associated with shame, stigma, and deep-rooted societal taboo. So on the occasion of Menstrual Hygiene Day, celebrated annually on May 28th, we thought we'd take the opportunity to debunk some of the most common myths and misconceptions surrounding menstrual health. And to shed more light on the subject, I'm joined by a highly distinguished panel of domain experts. With that, I welcome you to our special feature, For Her, With Her. An initiative by Alembic CSR presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynaecological Societies of India. Please allow me to introduce our guests. We have with us the President of the Federation of Obstetric and Gynaecological Societies of India, or FOGSI, Dr. Jaideep Tank. Vice President of FOGSI, Dr. Girija Wagh. Chairperson of Endoscopy Committee at FOGSI, Dr. Subhash Malia. Joint Treasurer of FOGSI, Dr. Niranjan Chavan, and Clinical Director and Chief IVF Consultant at Hegde Fertility, a unit of Hegde Hospital, Dr. Vandana Hegde. Thank you so much, ladies and gentlemen, for taking the time to join us in studio. And Dr. Tank, I'd love to kick off the conversation with you. In a country like ours, period poverty is unfortunately a reality. And the reasons for which are perhaps multifold: affordability, accessibility, and of course, awareness. So help me debunk some of the leading myths and misconceptions that typically surround menstrual hygiene.
Menstrual hygiene is one thing within the gamut of women's health, which is surrounded by a huge number of taboos, misconceptions, myths. And I strongly believe that all of this ultimately results in a bit of stigmatization.
Of course.
Which results from a poor awareness of the fact that menstruation is not a disease. Menstruation is a physiological event which occurs in a woman's life repeatedly over a very long period of time. And some of the misconceptions could essentially be related to this fact that women are simply not aware, and also the fact that perhaps there is not an adequate communication between both their peers and themselves, and between the elders and themselves. Of course, there are several cultures, not only in our country but in the world, where initiation of menstruation is celebrated because it makes a landmark in a woman's life. But even in those cultures, you will find that the individual who actually starts menstruating and then continues to menstruate is actually subject to a lot of misconception. And there is also the whole issue of comparisons. Everybody's menstrual cycle is different. And when girls of that age or any age actually communicate with each other, they do that without a framework of understanding the fact that menstrual bleeding has got a very broad range of normality. Menstrual cycle, although classically we say 28 days or monthly, the fact is that a menstrual period anywhere between 24 to 42 days is normal. The amount of bleeding can also vary from maybe 1 pad a day to around 5 or 6 pads a day. And this is all normal. And the perception of what is normal is sometimes not understood, which actually leads to a lot of misconception. And it's also the issue of how do you dispose of the menstrual hygiene product. It's supposed to be something which is private. And yet, women in a large part of the country don't have that privacy. And lastly, I think it's the misconception of the economic cost. Menstrual hygiene products are not available for free. When there is someone who is struggling with basic subsistence, that cost sometimes causes problems to occur, misconceptions to occur, and in an effort to save that cost, perhaps not the best menstrual hygiene practices are sometimes adopted. So as I said, mental framework, awareness, and a lack of the frame of reference of what constitutes normal versus abnormal for me would be the largest, perhaps, misconceptions about menstrual hygiene.
Well, Dr. Tang, I want to build on some of your observations. Coming to you now, Dr. Vag. So in your point of view, medically speaking, what actually even constitutes medically sound menstrual hygiene management, right? What are the recommended do's and don'ts?
First and foremost is when Dr. Tang just now said to us that it is a physiological by and large, and it's something which is encompassing the woman's life, entire life. We need to look at it a little non-medically as well. However, we have to be there to guide them about how they will take better care of their own health.
Sure.
Now, one of the components which Dr. Tang has already addressed is looking after the menstrual hygiene on a personal basis, like what products am I going to use? Right. How am I going to dispose them? But in that, there's something addendum, and that is how often am I going to change them? Now, that's very important because, you know, many times when we speak to women, they would say that we would change them maybe 12 hourly or maybe, you know, at the end of the day, end of my office. But it's not so actually. Ideal recommendations are we have to change it every 4 to 6 hours because there is possibility of bacterial growths. Sure. It's not about the amount of bleeding that you're having, but about other aspects as well. Now, an amount of bleeding is something which can be very perceptive. Sometimes it may go wrong, and sometimes it may be totally underestimated. So in that case, it's always better to find out from a doctor whether it's all well or not with you, because it may reflect in many other forms. Maybe you will be anemic, you will have fatigue and all. Sometimes clotting, excessive clotting is pathological. So that is where you require to consult a doctor, because excessive clotting of blood may tell you that you're bleeding so much that your body mechanisms are not able to take care of it. Sometimes pain is absolutely not understood. Many times they are told to, you know, use hot fermentation or something like that. But it's not always right. Many times simple measures like taking painkiller medicines which reduce your pain and inflammation help, because they would then stop that process and make your experience of menstruation better. Right. And another important thing is there may be an underlying problem there, which we require to analyze earlier. Conditions like endometriosis and polycystic ovarian syndrome, if they're identified early on, looking at the menstrual cycle, we would be able to better take care of these things. So simply putting, menstrual cycle is a very physiological condition, right. But the moment you see that there is any self-doubt or it's wavering or it's a little different, it's always a good practice to get yourself assessed. And additional supportive systems would come in: proper diet, nutrition, exercise, walking, and trying to not do things which are right. So don'ts, when you asked me, I thought hot fermentation is a big don't, because we shouldn't do that. And ignoring the pain is another big don't. And ignoring heavy bleeding is another big don't. So these would be my take on how do you appropriately have medical approach to menstruation.
Absolutely. Coming to you now, Dr. Malia. Help us better understand the extent to which menstrual hygiene can impact not just a woman's health overall, but her reproductive health in particular.
It's an extremely important and it's a neglected issue, basically. So why it is a very important issue is because the problem that we have is an accessibility. The problem is the accessibility of the products, either be a sanitary napkin or a pad or a tampon. Now it's, of course, it's obsolete.
Or a cup.
Or a cup. And cup is the new kid in the block, and then the green revolution coming up. A lot of people are giving a lot of emphasis on the cup. I think it's accessibility to this is something which is very important. Secondly, the issue is with, as Dr. Tang already said about, is the privacy part of it. Now the privacy part of it is very important because, as Sir said, it's very difficult, you know, as in a household or in the schools. Many of these children in the rural areas, in the schools, they find it very difficult. And more importantly, if you go by statistics, the toilet rates are so very less in the country. And this is where I would like to really bring in the Government of India and state government initiative of the Swachh Bharat Abhiyan, which actually has helped us to have a lot of toilets, you know, and making it more easy for the girls. Coming down to the topic per se, which you asked me about the reproductive health. Now, the symptoms that we, as Madam said, some of the girls would use it for 12 hours, but ideally speaking, it's about 4 to 6 hours, whatever it is. You can use a cup or anything is fine, but it should be 4 to 6 hours. And more importantly is the hygiene part of it, because when you keep it for a longer time, you have a sort of infections. You can have the toxic rashes again. You have a kind of the rashes. You can also have infections. It could be the vaginal infection. It could be the pelvic inflammations, all in turn leading on, you know, to a chronic disease called as a chronic pelvic inflammatory disease, which in turn can cause fertility in the future aspect. You know, it's very, very important that you have a good insight into the women's menstrual hygiene and the menstrual health.
Absolutely, and you make some excellent points, Dr. Malia. And coming to you now, Dr. Hegde. So I'd love your take on the extent to which lifestyle choices, be it levels of stress, for example, or diet, typically impact one's menstrual cycle and menstrual symptoms, essentially.
So whenever we talk of abnormal menstruation, it could be either in the form of, the cycle duration may be lengthening or shortening, or the flow may be increasing or decreasing, or there may be pain. Another important part is the premenstrual syndrome, which we talk very less about it.
Right.
And when it comes to lifestyle, the two major components are our diet and exercise. And when it comes to diet, what I would like to point out is mainly the inflammatory foods, especially, the fast food life that our youngsters are leading today,
right.
the westernization of the diet.
Right.
So these things, I think we need to go back and look at it, whether, you need to actually have a good knowledge about our own Indian culture. Why is it so? And, certain changes have to be made, mainly with respect to the processed foods. Maida, sugars, bakery items. These are very inflammatory for the body, and these could increase the sensitivity to pain, especially around the menstrual cycle. So the opposite would be good, taking anti-inflammatory food, especially your omega-3 fatty acids, flax seeds. So these are kind of protective for the pelvic organs. And the other important thing is your salt. High salty food around menstruation could cause a lot of bloating. The caffeine intake, the alcohol intake, these are all causing a higher sensitivity to all the menstrual symptoms around that time. And the other important part that you spoke about is the exercise, where exercise is very good for the body because it releases a lot of endorphins that we tell. These are all feel-good hormones. Right. So during the menstruation, when there are endorphins, it kind of gives a protection to the pain. The kind of exercises that you do should be actually what works best for that girl.
Right.
There is no hard and fast rule. Coming to stress that you mentioned, yes, see, stress is individually, each person is different. The way body accepts. Some live on stress. They like that the adrenaline thrill, but some can't take it. We get young girls, in 10th and 12th, when they prepare for their exams, they come with missed periods. So very commonly they come because this is natural body defense mechanism actually. So when it comes to stress, again, relaxation therapies. If a person feels they need to address these issues and go for, meditation, relaxing, exercise in the form of, pranayama, breathing exercises, or even, sometimes, you focus your mind at what you're doing.
Right.
So that is something that I think youngsters should be aware of it. And altogether, I would say that, gynecologist is always there. The program is on for her, with her. Right. So the most important message I would tell young girls is your gynecologist is always your friend. You visit them early on because they get the right advice.
Fantastic. And Dr. Chavan, so speaking of interventions, under what sort of scenario might a young girl consider delaying her monthly menstrual cycle? And what are the typical consequences of those interventions, of that decision to do so?
A very important question. It's not only young girls, but women in reproductive age,
right.
Women who are just perimenopausal, just pop in the pills, to delay.
Right.
Now the delay, because there are exams, some of them want to go for a religious tour.
An athletic competition?
Yes. And we need to give them certain prescriptions, but do not do self, go on taking on your own. Your gynecologist is a friend. You can just call, you can just talk to them, and then they will advise you properly.
Right.
You have to understand the risk and the benefit, and taking prolonged estrogen over a period of time and trying to delay the periods is going to really affect your whole milieu of hormones. Right. It is going to cause excess of estrogen in the body, and over a period of time you might land up with irregular menses, infertility, or you might have something like hyperestrogenic state of a kind. So all these things you have to weigh. Just don't pop in pills which are just to be required if necessary. Right. And do not take on your own. Yeah. Because the measurement of the drug, the dosage is different for each and every condition, and also you might be having some other issues. And you just need to call us. We are always there to help you. We are always there to guide you.
Seek the guidance of a medical professional.
Yes.
All right. It's time for a short break, but we'll be right back, so stay tuned. Welcome back. You're watching For Her, With Her. An initiative by Alembic CSR presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynaecological Societies of India. Coming to you now, Dr. Vag. We can't have any conversation around menstrual health and hygiene without discussing menorrhagia. So if you could help me better understand in layman language what the condition is and how the diagnosis and the treatment typically differs amongst adult menstruating women versus adolescents.
Now, menorrhagia typically means heavy menstrual bleeding. So it doesn't mean frequency or anything, it just means that she's bleeding heavily whenever she gets her menses. And that bleeding can be large in quantity, it will be in more amount, volume, and it can be also for a longer period of time. And that implies that there's something not really right there. Now, many a times, whenever you're trying to evaluate what could be the reason why the woman is bleeding heavily, it is divided into two aspects. One is a functional aspect and another one is an pathological or an organic aspect, as we call it.
Okay.
Now, functional would be typically seen in young adolescent girls where their body is yet trying to adjust to the complex HPO axis, and therefore in the beginning of her, just at the beginning itself, she wouldn't have cycles which are coming, hilched to the time, and in that setting of the cycle thing has yet not happened, and it would continue for 2 to 3 years where she's not ovulating. So there is one particular hormone which is supposed to be, there are two hormones which are having a balance totally to maintain the entire menstrual cycle.
Estrogen and progesterone.
Yeah, estrogen and progesterone. The one hormone, that is progesterone, is a little deficient, and that is the reason why the lining of the uterus, which is getting shed off, is not getting shed off properly. So that is the reason why she would bleed heavily, because her inherent mechanisms, which are trying to control that bleeding, are yet not set. So many a times it just, it's just trying to analyze this condition and trying to give her some medications which will try to imitate her own natural cycle without causing any harm to her growth parameters or anything, can be undertaken. Another aspect is the organic component, and that is something that is definitely of concern, and that's where we have to pitch in to investigate it correctly. For example, there can be some disorder in the local place itself. She may be having a tumor, or she may be having a disease, especially in India. Genital tract tuberculosis is quite common. So it will start off with a heavy menstrual bleeding, and many a times that's one thing which we have to keep in mind, whether there is any underlying disease like this. Young girls today, as the society is changing, are suffering from a lot of nutritional disorders, and especially in the the non-urban places, we find that anemia and hypothyroidism are quite rampant. It's not that they are rare anymore. Probably we are investigating them more. That can be the reason. We have become more aware, and therefore we are coming to know them. But these are also the ones which are contributing to very heavy menstrual bleeding, and that's the reason why it's important that we investigate. Another aspect is inherent clotting mechanisms. Now, it's a little rare, but it is quite now understood nowadays that because we have now access to doing tests, so we look at the coagulation parameters, we find out whether there is anything. So there can be some defect in the clotting systems. But these, the doctor may evaluate for you, and then we'll try to find out that, okay, this is a menorrhagia, which is just transient, maybe it requires a little support. Maybe this is one which requires treatment because you may continue to bleed all your life, and there are certain things which can be just checked off. So what is very important if you're bleeding heavily is definitely consult a doctor.
Right.
So therefore, menorrhagia is something which really requires to be investigated, and that's something which should not be ignored.
Right. Well, my next question I'm going to pose in 3 parts. Starting with you, Dr. Malya. A woman has a very colorful journey in life. She has many roles to play. So for a woman that is perhaps pregnant or lactating, right, what's the menstrual hygiene management approach that you endorse?
In a lactating lady, the problem that she has is she has to look after herself and she has to look after the kid also. So that's why it becomes a double whammy for her to be very difficult. But on the whole, the difference doesn't make much of a difference in terms of hygiene aspect. But what she have to understand is she's going to have a lot of issues in terms of bleeding in the initial phase. There is something called as normal physiological bleeding that she's going to have up to about 6 weeks. So tell her that about that, it's a normal thing. But anything that goes beyond 1.5 or 2 months, and she still has a bleeding aspect, I think there needs to be some evaluation, and I would always request her to go and meet her primary physician or primary gynecologist here to have an idea about it.
Yeah. And coming to you, Dr. Hegde, all the way from postpartum women to premenopausal women, how might you guide them in terms of menstrual hygiene best practices?
So this is the reproductive age group, and here what happens is, as we have already spoken about the 3 modalities that is already available, we have the pads, we have the tampons, and we have these menstrual cups. The cloth and the pads are the most commonly used menstrual hygiene products. The hand hygiene, which is very important, that whether before they use and after they use, that's very important that they maintain the hygiene, and maintaining the adequate storage facilities for these. Now coming to the pads, the only concern is if they don't change as and when it is required, according to her symptoms of her bleeding episodes, how they last, then that could be a chance of, that wetness promoting infections and the rashes and the irritation. So these are some things that they need to take care, especially with respect to vaginal infections and urinary tract infections. If the girl is really using a tampon, she needs to only ensure that the vaginal secretions are normal secretions. Sometimes when you use high absorbent tampons, they could get very dry, the vagina, and that could itself predispose to small cuts, micro abrasions when you remove and put it back. That itself will be a source of, whenever the skin is intact, it's a protection barrier. Any kind of an abrasion will give rise to it's an entry point for all types of organisms. It could be bacterial infections, it could be fungal or the yeast infections. So these are common things that lead to starting with bacterial vaginosis, and then it lands up with more serious conditions like the pelvic inflammatory disease, or commonly called the PID. So another important part of the menstrual cups again is the insertion and the removal technique, because today girls are getting very comfortable with the cup. So only thing is that they should be very sure that they don't have any breakout of this skin, any abrasions, small things that which could be a source of infection again. As they move from the reproductive age group to the perimenopausal transition, what we tell, every small variation in their cycle is something that needs to be addressed upon as soon as possible to catch them early on for an effective prevention, and then we prevent complications in them.
And to you, Dr. Chavan, women that are suffering from disabilities.
Disabilities, that is the worst scenario parents go through when they have a child with Down's syndrome, and I've seen that in educated women and parents, and they are really struggling to go through the whole process. And it can be a really complicated thing. You might be having a patient with physical disability, say polio, or you might be having a road traffic accident, and suddenly you're bedridden. And then you have to go through the whole process. Menstruation is not going to stop. It is going to be a part of the body, and that needs to be attended very sensitively, the respect of the patient, understanding their needs. And I have seen patients who have come for hysterectomies. That decision has to be taken because it's going to be there for a long time. Maybe after the parents are becoming older, the other family members are going to take over, and it's really a very struggling issue which we need to understand. And there, the changing of pads, the proper disposal of the pads, technique to be put in, there needs to be an attendant, and all these things have to be taken care of.
And Dr. Tank, there are so many layers of deep-seated cultural and social taboos that surround menstruation, worldwide, but especially so here in India. So what can you, in your own personal and professional capacity as gynecologists, as medical professionals, do to help destigmatize the subject? What can and must gynecologists do? Well,
honestly speaking, I think as gynecologists, we are pretty much normalized to menstruation. I would like to believe, and I do think that it is true, that most of the stigma which comes around menstruation does not come from the medical profession. The medical profession is quite well aware that it's a physiological event. We look upon it as something which is a part of life. The stigma perhaps would come more from the community, and I think it comes across because, as we've already talked, from a lack of awareness. It also comes from, to a certain extent, tradition. And traditions are good, but there are some traditions which may not necessarily be the best, and we need to address the mindset which surrounds these traditions. As a gynecologist, I would have to say that one of the things we should be doing is not assuming a level of knowledge for someone who's menstruating which may not exist. Because we are medical professionals, we sometimes assume that even the word menstruation, for example, is familiar. We need to speak in the patient's language, and we need to speak in a language which is non-stigmatizing and non-judgmental. Of course, it's a two-way street. When you talk about respectful care also has to translate into respectful behavior by the patient. And that's why when we talk about these things, I think the fact that it's normal, the fact that it's physiological, and the kind of language and terminology that we use, all of this has to be taken into consideration to promote more respectful, a more open, and perhaps a more kind of behavior where we look upon menstruation not as something which needs to be taken care of, but as something which is a part of a woman's life, and empower her to make sure that she can handle it as well as she possibly can.
Absolutely. With that, thank you for sharing such a rich range of insights from your personal journeys and your professional journeys. Thank you so much. With that, our special feature, For Her, With Her, an initiative by Alembic CSR, presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynaecological Societies of India, comes to a close. Thank you for tuning in.